Prednisone. Imagine your body's defense system is like an army. Sometimes that army gets a little too aggressive, attacking even when it shouldn't, like in asthma, arthritis, or allergies. Prednisone is like the general who steps in and says, "Calm down, soldiers." Prednisone is a steroid medicine that reduces inflammation and keeps your immune system from overreacting. It's powerful and often life-saving, but while it helps with swelling, pain, or breathing, it can also change how your body handles food and fat. Prednisone can make you feel hungrier than usual, so you snack more. It also changes where your body stores fat, often around the belly, face, and back. Some people even call the rounder moon face look a classic side effect. On top of that, it can slow your metabolism a bit, making weight easier to gain. So while prednisone is incredibly useful, especially in emergencies, doctors usually give it for the shortest time possible or at the lowest dose. It's like having a strong general, great in battle, but you don't want him running the whole country forever. Olanzapine. Now picture your brain as a big city with lots of traffic lights. Signals tell you when to sleep, when to eat, and how to feel. Sometimes, in conditions like schizophrenia or bipolar disorder, those signals get scrambled. That's where olanzapine comes in. Olanzapine is an antipsychotic medicine that helps clear up those signals, making thoughts less chaotic and moods more stable, but it can also switch on your hunger light more often than it should. Suddenly, food feels more rewarding, cravings grow stronger, and meals seem more tempting. On top of that, olanzapine slows down metabolism, how quickly your body burns energy. The combination between more hunger and slower metabolism often leads to weight gain. Some people also see changes in blood sugar or cholesterol, which means doctors keep a close eye on health while prescribing it. Olanzapine is like a traffic controller. It makes the city run smoother, but sometimes causes extra food trucks to show up, crowding the streets. Clozapine. Clozapine is a close cousin of olanzapine. It's also an antipsychotic, often used when other medicines don't work. For some people with schizophrenia, it can be life-changing, clearing hallucinations, easing paranoia, and helping them reconnect with reality. But clozapine has a strong effect on appetite and metabolism. It can increase cravings, especially for carbs and sweets, and make the body store fat more easily. Weight gain is common, and sometimes it's significant. Doctors balance this by monitoring diet, encouraging exercise, and checking blood tests regularly, because clozapine can also affect blood sugar and cholesterol, raising risks for diabetes or heart problems. Still, for many patients, the benefits outweigh the side effects. It's like a heavy-duty repair crew for the brain's wiring, incredibly effective, but it tends to leave some mess behind, like weight gain. Risperidone. Think of your brain like a busy train station. Messages are the trains, and they need to run on schedule. In conditions like schizophrenia, autism, or bipolar disorder, those trains sometimes derail. Risperidone is like a station manager who helps keep things on track. It calms racing thoughts, stabilizes moods, and reduces aggressive or disruptive behavior. For many people, it's a big help in daily life. But, like other antipsychotics, risperidone has a side effect. It can make you hungrier. It changes how your brain responds to hunger and fullness signals, so you might feel like eating more often than usual. It also affects hormones that regulate weight, and in some people, it slows metabolism. The result? Extra pounds can creep on, even if you're not eating much more than before. Doctors know this, so they monitor weight, diet, and sometimes suggest lifestyle changes alongside treatment. For some, risperidone is worth it because it brings calm where there was once chaos, even if it means being extra careful with snacks. Amitriptyline. Imagine your brain as a telephone switchboard. When you feel pain or sadness, signals travel through those lines. Sometimes the system gets overloaded, leaving you in constant pain, headaches, or depression. Amitriptyline is like a technician who fixes the switchboard. It's an antidepressant from the tricyclic family, often used for depression, anxiety, or even chronic pain. It helps rebalance brain chemicals, lifting mood and reducing pain signals, but it comes with a sleepy, cozy effect. Amitriptyline can make people drowsy and slow their metabolism. On top of that, it can increase appetite, especially cravings for carbohydrates. That combination, eating more and burning less, makes weight gain common. For many patients, the benefits outweigh the side effects: better sleep, less pain, and relief from depression. But doctors usually prescribe it carefully, often at bedtime, and keep an eye on weight changes. Think of amitriptyline as a helper who fixes broken phone lines, but while they're working, they also sneak in with cookies. Paroxetine. Paroxetine belongs to the SSRI family, selective serotonin reuptake inhibitors, a group of antidepressants. If serotonin is your brain's happiness chemical, then paroxetine helps keep more of it around, improving mood and easing anxiety. It's often prescribed for depression, anxiety disorders, OCD, and PTSD. For many, it brings much-needed relief and balance, but paroxetine has a reputation. It's one of the most likely to cause weight gain, because it changes how the brain regulates appetite and metabolism. Over time, some people notice increased hunger or slower calorie burning. It can also make you feel calmer, which is great for anxiety, but less movement and more comfort eating can add up on the scale. Doctors sometimes choose other SSRIs first, but if paroxetine is the best match, they'll pair it with advice on healthy eating and exercise. It's like having a comforting friend who brings you peace, but also tends to bring snacks every time they visit. Lithium. Okay, I'm not talking about Nirvana's song, which I really like it. Now, imagine your mood is like a swing. Sometimes it goes way too high, the manic. Other times it drops way too low, the depression. For people with bipolar disorder, that swing can be exhausting. Lithium is like a steady hand holding the swing, keeping it from flying too high or too low. Lithium has been around for decades and is still one of the most effective mood stabilizers. It reduces manic episodes, lowers depression risk, and even helps prevent suicide. But it also comes with side effects, and weight gain is one of the most common. Lithium affects the kidneys and how the body balances salt and water. That can cause bloating and water retention, making the scale climb. It can also increase thirst, so people drink more, sometimes reaching for high-calorie drinks. Add in a bit of increased appetite, and the pounds add up. Doctors carefully monitor lithium levels in the blood, since too much can be dangerous. It's like a powerful tool, extremely helpful, but requiring constant checks. Lithium steadies the swing, but sometimes it also adds a little extra weight to the seat. Valproic acid. Valproic acid is used for epilepsy, bipolar disorder, and migraines. Think of it as an electrician fixing sparks in your brain. In epilepsy, brain signals fire too much, like faulty wiring. Valproic acid calms that activity, preventing seizures. But this helpful electrician has a side effect. They make you hungrier and change how your body stores fat. Valproic acid can increase appetite, slow metabolism, and even alter hormones that regulate weight. Some people also experience changes in insulin resistance, which makes weight gain more likely. It's especially tricky because valproic acid is often taken long-term. That means small, steady weight increases can add up over months or years. Doctors try to balance the benefits, no seizures, better mood control, with these side effects, often adding advice on diet and regular exercise. For many patients, valproic acid is a lifesaver, stopping seizures or stabilizing moods when other medicines fail, but it often comes at the cost of needing extra care around weight, like an electrician who fixes the wiring but leaves the lights on all night. Insulin. Now, insulin isn't just a medicine, it's also a hormone your body makes naturally. Its job is simple. When you eat, insulin helps move sugar from your blood into your cells for energy. As simple as you hit that like button and subscribe. People with type 1 diabetes and some with type 2 diabetes need insulin shots because their bodies don't make enough or can't use it properly. But when you take extra insulin, it helps the body absorb more sugar, which means more energy stored, often as fat. If blood sugar goes low, people may also eat extra snacks to avoid hypoglycemia or low sugar. Over time, this combination can lead to weight gain. It's important to understand, insulin itself isn't bad. It keeps people with diabetes alive and healthy. The weight gain is more of a side effect of how it balances blood sugar and appetite. Doctors often pair insulin therapy with lifestyle advice, diet plans, or other medications to help manage weight. And thanks for watching.